Hey, this is the cascade. Yeah, this is the cascade effect. No, this is not the cascade effect. This is the undercurrent.
It's the
And
spin-off of the cascade effect, the
yes, it is.
undercurrent.
Yep. And I'm Kevin.
I'm Tony.
What are we gonna go? We're going after another article,
Well,
aren't
we're
we?
we're recording two shorter ones, so we don't got a story here. So, as
Yeah.
Kevin was saying at the start, we should probably change our shirts. But I'm I'm fine with it. I don't think people come on here to watch what our wardrobes are.
I don't think so. They probably. No, I mean, nobody said anything about my Christmas stuff yet.
Mm-hmm.
Can you see it?
I can.
Oh, yeah,
Did you
gingerbread.
decorate it, or did Anne decorate it?
No, I decorated it.
Looks
I did
very
my.
nice.
No, thank you. I tried miserably, fail, but that's okay. That's all right.
Okay, so what we're talking about today is not quite just Montana focus. It's really across the U.S. It's talking about healthcare because, I mean, I definitely understand a lot of the, especially more recent Democrat criticisms of the Republican Party on healthcare reform because they let Obamacare happen and then they've never really had the Republicans never really had a solution to it other than trying to get rid of it, which I think there needs to be a more tactful solution to here. I don't think we can just cut these sorts of programs after they've been implemented, unfortunately. And so I think something that I've been talking about is what we're going to be talking about here is essentially healthcare vouchers or healthcare insurance vouchers. And to me, I've been seeing more and more things that make me a little more confident in the Republican Party. This being one of those. Like if they are tackling this, I mean, I'm sure I will still have a lot of disagreements with the Republican Party, but this is one that if they can really push this and reform how we purchase insurance across America, I think that would go a long way in terms of bringing us affordability in general, as well as demonstrating that they are, actually looking for solutions as opposed to just, trying to tear down programs without necessarily thinking about those immediate repercussions.
Well, I mean, I have to pay for my family's insurance, so I'm playing this game, and
Mm-hmm.
this game scares the hell out of me. Because when we're
Yeah.
starting to mess around with healthcare and my children and all of that, this is something that everybody should be aware of, and I guess I'm going to learn a little bit more today. So
Yeah.
why don't we just get into?
Yeah. We'll get into it. So, and I think this was posted probably elsewhere, but I saw this from the Frontier Institute, which is a think tank here in Montana. They're more libertarian leaning. I've really liked a lot of the stuff that have come out from them. I think they help push some of the property rights reform that we saw in recent years in terms of being able to modify stuff on your property without having to get a permit and zoning laws and that sort of thing. But now they are tackling healthcare, which this comes from a Trump proposal about him just saying to pay the people. And so we'll kind of get into it. So Trump's pay the people healthcare proposal would flip the script, cut out the bloated middleman, and let Americans control their own money and plans. Freedom of choice, lower cost, better care. So, in a November 9th post on Truth Social, President Trump outlined his plan for healthcare in his characteristic simple and succinct manner. Pay the people, not the insurance companies. Beyond the catchy slogan, is actually a really good policy idea that would reduce premiums, reduce deficits, and help thousands of Montanans to better access high quality, affordable healthcare. So, what does pay the people mean? Let's do a quick background of the context here. The Affordable Care Act, aka Obamacare, has been an utter disaster for affordability. Premiums for regular people have skyrocketed and put healthcare even further out of reach. Hundreds of billions of dollars in subsidies have been funneled directly to the insurance companies through Obamacare, intended to reduce costs for consumers with little effect. As President Trump notes, the practical impact of Obamacare concentrating subsidies and spending power with the insurance companies has been the insurers making a killing in profit while health coverage only gets worse. Over the last month, the federal government came to a standstill as Democrats demanded Congress continue to deliver billions in temporary additional Obamacare premium subsidies to insurance companies, despite these extra credits only being intended as support during the COVID-19 pandemic.
Mhm.
Enter
Right.
Trump's bold pivot: redirect Obamacare subsidies not to the big bad insurance middlemen, but directly to the people. This would most likely entail putting thousands of dollars annually into the health savings accounts or similar accounts, which could be used to pay for qualified healthcare expenses as determined by the patient. This would empower people to manage their own family's healthcare choices free from an insurance company's tightly regulated gatekeeping. The freedom of choice and flexibility offered under Trump's healthcare plan has multiple benefits. First, it would increase competition in the healthcare market, putting a downward pressure on costs. People could get People could better customize the mix of insurance premium and out-of-pocket costs that would work best for their healthcare, upping competition among insurance plans and products. Additionally, putting people instead of third parties in greater control of healthcare spending decisions will improve incentives to control costs and increase quality of services. One proposal for a limited pay the people style healthcare plan estimated it would reduce premiums by an estimated 12% and in turn lower deficits by $30 billion thanks to reduced subsidies tied to those premiums. The second benefit of Trump's plan is that funds could be used to access a broader set of services and providers than what an Obamacare health insurance plan typically covers. This would be especially great for patients in Montana, where state reforms have enabled a flourishing market of high quality, low cost healthcare options outside of the government dominated insurance system. With direct funding, patients could opt to pay for more services or medications with cash, often at a steep discount compared to paying with insurance. This would also liberate patients from in network insurance requirements, allowing patients to shop for providers they prefer. And thanks to the One Big Beautiful Bill passed earlier this year, HSA funds could also be used to pay for direct primary care memberships at one of Montana's 30 plus DPC providers, allowing patients to have unlimited access to comprehensive primary care services for just $87 a month on average. Patients would gain same day access to their doctors, longer visits, telehealth, and personalized health plans, not cookie cutter coverage policies from distance insurance boardrooms. Trump's pay the people healthcare proposal would flip the script, cut out the bloated middleman, let Americans control their own money and plans. Freedom of choice, lower cost, better care. So, what are
Well,
your thoughts?
oh yeah. I mean, every time I hear the Democrats or the Republicans talk about this, I I really just want to shove it up their ass. Because we've been kicking the can down the road now for how many administrations? I mean, he tried to get it done in this first administration and tried to work
Ar-
something out there.
Arguably, I would say that this all started even before like Obamacare came about. Like when Medicare
Mm-hmm.
and Medicaid came about, I think that was a big problem. Because I mean, the way I see it, and they sort of talk about it a little bit here. Our current health insurance model is a caste system. So it's a caste system being an analogy to what you see in India, where you have the rich people have a certain level of privilege, and you have different castes going all the way down to the lower caste systems where they have less or almost no privileges. But in terms of the context of health insurance, our castes are those with private insurance, either from their employer or they're purchasing it themselves. Those people on Medicaid and Medicare, where they are restricted in terms of what kind of medications and services and providers they can see, compared to what you see at the private insurance level. And then the third part of the caste system is the Obamacare
Yeah.
exchanges. So
Right.
all of those are just another level of what is allowed and what isn't covered, based off of what the government decides. And people who are more poor, they have to have either an exchange or be on Medicaid or Medicare depending on their age. And so it really comes down to where you are at in the lot of life and what sort of access to healthcare you can get, as opposed to trying to give everyone the same choice, or meeting those needs, or the cost to be able to get the type of coverage that you actually want or care about. Because at the end of the day, and they pointed out here, the insurance companies get all that money anyway. Like
Yeah.
Blue Cross Blue
Yep.
Shield, United Healthcare, whatever you have, they're facilitating Medicaid and Medicare, and they're getting some
Yep.
money on top of that. They're facilitating the exchanges, so they're getting some money on top of that, and they have their private insurance as well. So
Yep.
why have these big subsidies going to them instead of just letting the people figure out what kind of insurance they want? So someone on Medicaid, Medicare, and their exchange, give them a couple $100 voucher to go shop around the marketplace of insurance. They could pick the insurance that best fits them.
Well, I'm in that category of, well, poor. Okay. All right. So I mean, I walk in the realm. I think I'm you know, people are like me, and others are forced into this little bracket of we're seen as poverty, but we're, where is that, right? Where is that level within at any individual? But per capita healthcare expenditures in Montana, from past estimates, all right. Early data indicates Montana residents spend around 7,220 per person on personal health care, compared with a U.S. average of about 6,851, according to Montana Public. What? So where's my 12%? What's going to happen, Tony? What's gonna fix where we are? What in this?
Well, all of this really comes down to that artificial demand. So when the
Hmm.
government just puts money into the system, into a particular industry, I mean, we see this with how our Federal Reserve works. We see this with education, them providing federal loans, increasing the amount of tuition, and then in healthcare, putting more subsidies into healthcare insurance. Of course, those premiums and everything else, and the costs are going to go up because there's more demand or
Right.
dollars floating around that particular industry. And so, for one, there a lot of insurance companies have provided new roles like PBMs, the benefit managers, to help try and control some of those costs, or at least the um, some coordination between hospitals, health systems, and insurance agencies. So you have more employees to help soak up some of that extra demand,
Yeah.
trying to justify these prices. But at the end of the day, the value that's provided is no different than if you didn't have those people in the first place. And so that would be part of the idea is no longer do the insurance companies just have to try and get a state government to win their contract. They now have to,
Lobbyists.
yeah, they now have to try and lobby every
Yep.
single resident or citizen who wants insurance, which,
Yeah.
I mean, that comes down to free market principles. Like, how do you incentivize, or how do you provide a product or an insurance product that people would actually want to buy, as opposed to how can I convince the state of Montana to just let me provide this service for a couple million of its residents, and I get all of that lump sum money in exchange for that.
So, um, it, so uh, Medicaid. So another study here. Medicaid is over 22% of the state budget spending, which is slightly below the national state average share here in Montana. What does what does it look like if we can get this down to the 12%? That would be added on to the 22%. I mean, what would it do for our state, in our Medicaid?
Mm-hmm.
Would it do anything? I guess is another
I
question.
I'm guessing it would make us less dependent on federal funding for one.
Yeah.
Um, Also, you wouldn't need to have the state governments actually implement this program, because right now the state governments have are the ones who actually facilitate the Medicaid and Medicare.
Mm-hmm.
But if it's just the federal government putting money in HSA accounts, why do you need to have a middleman of the state government? So no longer would the federal government need have the ability to um, coerce state governments into doing different things for more federal funding to fund their healthcare. And it's also
So
no longer an unfunded mandate in some ways.
so going down a left-handed turn rabbit hole, Would this be able to be tied to um, the IDs and a different type of understanding of currency, where if you have your card, that would be linked to whatever these entities are that are giving the money to the people, right? Are you following me?
Yeah,
Crazy
potentially.
road, but
I would foresee it more as like a tax refund.
so at the end of the year they disperse it that way, and so
Yeah.
they would just
Hmm.
pull it off as a tax refund, and
Right.
we call it good, like Obama did to us when we had to pay.
Right.
That son of
Or
a pup.
yeah, so and there could be a couple of ways that they end up doing it, because how HSA accounts are currently set up is you if you have a qualifying insurance coverage, so a high deductible plan, you can put X amount of dollars. I think it's probably like a little over $4,000 per year right now into that HSA, which is a triple tax advantage. So you don't that money you don't have to pay income tax on, you don't have to pay capital gains tax on, um, and you don't have to pay any sort of passive income tax on there either. So it could be done in a way that, if you contribute to that on the yearly basis, and then you file your taxes in that following year, that there's some math done to give you that refund back for that money that's provided. It could also, I mean, and we saw this during COVID, that they were able to just hand out
Yeah,
checks to people.
like,
So,
yeah, I mean,
mhm,
remarkable.
right.
Yeah, that's
So
true.
that
That's true.
that might be another way
Another avenue.
that they end up
Mm,
doing that, as well. I mean, I understand part of the concern that they would people legislators would want to make sure that this money is going to healthcare expenses and not just extra spending money for people to spend on whatever.
right,
So there would probably have to be some controls, or at least some amount of bureaucracy that ensures that. But at the end of the day, it's going to be a lot less bureaucracy than managing the Medicaid and Medicare, setting up the rules of Medicaid and Medicare, and their formularies, and all of that. So
right. Huh.
overall, it's going to be a cost savings, both on in what people pay out of pocket, but also about how much the government spends in being able to facilitate such a program.
Well, it's definitely one to keep an eye on, and I know
Hmm.
how hard it is for them to impress you about pulling something off in this Republican Party
Well,
that
and
exists.
this one would be big. Like
Yeah,
how the Democrats or the liberals think about Obamacare, seeing that as big. This would be big. This has the potential. This, along with opening up insurance purchases across state lines,
yeah, that'd be
um,
great.
and somehow detying employers from your insurance companies as well. So
Yeah,
allow employers to just give you free cash to be able to use on insurance, as opposed to them trying to negotiate for the entire employee base. Like those three things, this the HSA that they're proposing here, purchasing across state lines, and then detying from employers. Like if we could do those three things, I think a lot of our healthcare issues and affordability issues would be on the way to being solved pretty quickly.
well, there you have it from the expert. I just learned a whole bunch of stuff today. I'm definitely smarter than I was when I got on about the healthcare. I just don't know how they're going to pull off the 12. I don't know how, the mechanisms. They love to explain this. That's why I told them, they could probably blow it up their rears, because
Mm-hmm.
I'm sick of the squawking. Let's get it done.
Yeah.
If it's a plan that is out there and you are making that plan, right? Then we should be transparent to see the numbers, right? We right now, if they're going to roll us out, get the public the numbers. See, let them, and so we can understand it, please. That'd be
Mm-hmm.
fantastic, right? I mean, it's so complicated these days to read whatever is on there, and that's a
Right.
shame, because a lot of bills that just came through, people voted on because of, well, they pulled at their heartstrings when we should have probably been pulling back a lot more than what we even thought about in the last big great bill or whichever,
Right.
and the shutdown. And so,
Well, and I think you have a good point about, like, none of this is easy to understand, and part of that is
no,
because our healthcare system is such a conglomerate of different healthcare policies, and like even trying to understand Medicaid and Medicare on its own.
yeah,
I mean, that's why you have actual experts in those areas who their whole careers have just been in insurance or in facilitating state provided health insurance. And so I think that's one of those elements that it's hard to communicate how these things can be solved, just because the whole idea is to eliminate most of it, with the idea that you
that'd be
have
nice.
some funds floating around.
I wish
So,
we all had the ability to make enough money to say, I want Blue Cross Blue Shield. This is where I want. I don't need
mhm.
that to cover me. And the American people can prosper with an egg in a little egg's nest as well. We have come so far left of that type of ability, and if this can help that type of ability, then it needs to be moved
Mhm.
forward. But we need to see the data, we need to see the
Yeah.
numbers, and
Well,
see where that goes.
and I think, because if this truly becomes a Republican part of the Republican platform,
Yeah,
they and
really,
I think it should, and I think this should be one of their main focuses, is actually providing a solution to our current healthcare situation. Because at that point, that becomes a major voting issue
sure
for
does.
Republicans and voting for them, and then
Yeah,
all of a sudden, um, their whole goal is to try and build the political will for that, as opposed to the political will for Medicaid for all or Medicare for all. Which, I mean, right now, I think a lot of stats always have been indicating that the majority of Americans would favor some sort of Medicare for all style healthcare, which is
yeah,
it's disappointing, because I don't think many people understand what that means.
yeah. But again, they moved my retirement to 67. They're stealing my money, man. And they keep moving it up and moving it up and making us dependent on them, and that's wrong. It's all 67 is almost inhumane to me. I mean, a lot of people don't get to move around that age.
Mm-hmm.
Drugs or not, if you want to take them or not. And this is a very big issue that needs to be solved. And I know I'm looking at it. I'm like, okay, fine. I'll just stay working until I'm 70, because you guys keep upping, and I have to take it. If I take it early, I get penalized when I probably have twice as much money as you're going to give me on the way out. Jerks.
You'll be the wise old man at 70,
Philly.
teaching kids, still trying to learn the new technology.
Yeah. Well, hopefully, you get a couple of them, so they'll actually be fighting for all of this, to make sure that their liberties and freedoms, and they have control of it with this digital money and the cards and everything else. That's why I kind of went down the rabbit hole with that, because it's true. If you have your card, they can supplement that with it's going to have your health insurance on it. It would have and all that data that is there. I'm not saying it wouldn't even make it easier for that, but we can't say that it's going to be secure enough for me to put in my wallet.
Mm-hmm.
But then again, is it secure now? Nope. I've had to get a new bank card like 2 times now in the last 2 years. So
Yeah,
the
your
hackers
bank is
are,
probably part of the Federal Reserve, so
yeah, probably. Yes. Yeah.
who has access to that money whenever they want?
Exactly.
Remember, most banks, I think, at the current recommendation, they don't even need to have any reserves in their banks right now. That might be a little
Which
off,
is,
but still, they could have
if
low
that's
reserves.
true,
Yeah,
oh my gosh. Oh man, that would stink. That wouldn't be good.
avoid the next bank run. Pull it all out now. Get it in gold, silver, Bitcoin.
Got anything else to say about this topic?
No,
Well, this is the Undercurrent, and I'm Kevin.
I'm Tony.
Come back next time.